My name is Elizabeth King, and I'm a transplant surgeon here at Johns Hopkins. I specialize in both liver and kidney transplants in our adult and pediatric patients. I went into the field of transplant for a number of reasons. What I like most about it is it's technically challenging in the operating room, and the patients are medically complex. What's very enjoyable is that we get to build a long-term relationship with the patients. We follow them not only before the transplant, during the transplant, but for years after the transplant to ensure that they have a successful course. I believe that our patients should be active participants in their care. I work to educate them on all the clinical decisions we make for their surgery and for their post-transplant care to ensure that they understand the process and they can easily communicate their preferences. I believe when they're more engaged in that process, they ultimately have better outcomes and are more satisfied with the relationship they build with the team. At Hopkins, we have a large research group dedicated to understanding clinical outcomes following transplant. As part of that group, my particular interest is understanding how our patients engage with the healthcare system and how that ultimately affects their outcomes. In particular, I work to understand differences based on social factors that influence healthcare engagement and ultimately impact how our patients do following surgery. My favorite part about transplant surgery is we take the sickest patients and give them a second chance at life. To me, that's a miracle. I strive to build a lasting relationship with our patients that ultimately will help that process be a success.